A few days after being inaugurated, President Trump was signing a ton of executive orders and memoranda, and one of those he signed was the Global Gag Rule, also known as the Mexico City policy. Typically, Republicans enact it and Democrats repeal it. What it does is it cuts any kind of funding that is abortion-related overseas. Something that's really important to note, the US has never funded abortions overseas. So this isn't to fund abortions, this is to fund kind of services around reproductive health. President Trump's version of the policy didn't just affect abortion-related services in countries like Uganda. It affected the most basic healthcare in that country and in many other countries. Is there any area of healthcare that is not affected by this policy?
I struggle to think about what isn't affected.
Are childbirth services affected?
Yes, childbirth services are affected, definitely.
Mammograms?
Mammograms are affected.
HIV/AIDS?
Yes.
Malaria?
Yes, malaria prevention.
Typhoid?
Yes, exactly. It will be affected.
I think what's most surprising being here and talking to you on the ground is that the vast majority of services affected have nothing to do with abortion.
Yes, that is the irony of the whole thing. I mean, Uganda is the country that abortion is very restricted, so there is no reason why the Mexico policy should apply to us here.
We met one woman who says that she was forced to have sex with her husband, said that he's a very sort of abusive person, and she became pregnant as a result of it. How far along are you in your pregnancy? Contraception used to be free for you, but when you went in and they told you it was no longer free and that you had to pay, did they tell you why? When was that? There's a lot of stigma around birth control, and her husband didn't want her to be taking it or using a condom. And so she became pregnant, and she could not afford to have another child. Her husband doesn't work, and she's working just enough to get by to provide for her other children. So she decided to get a backstreet abortion. These backstreet abortions are incredibly dangerous. There are a lot of women who die from them. We heard that both from women who knew people who had been killed by going through this, and one backstreet abortionist who sees women regularly, who knows that what she's doing is not safe for the women, but does it anyway because she's trying to survive. Has anyone ever died after receiving an abortion from you?
Bafa mulimu gokolako ng'olubuto olususse ku myezi gy'ebyo byembawa n'omukolako ne kikutukakutuka olunsi n'alemwa n'afa n'olw'okuba abaana bo tebalina kawunga kati oli najja leno ebeerwa lwa myezi 7 kaka akawunga kaweddemu mukolako bw'afa ng'afa.
When girls come to you, do you tell them that they could potentially die by doing this?
Tolina kyoyinza kunnyonnyola muntu ku kufa n'oba ng'ojja mukolako omubuulira bubuulizi kyakkola. Olaba ng'obreedinze ennyo gendako mu clinic. Olaba nga kikoze bwe kiti komawo oba nkubira essimu. Ne tosobola mugamba nti ngenda kukolako naye oyinza okufa.
We saw firsthand the effects of these backstreet abortions. We went to one of the biggest hospitals in Kampala in Uganda, and we walked into a room and it was full of women on beds who looked like they were in extreme pain, who had come in after, basically backstreet abortions. So you see a direct connection between decreasing access to contraception and unsafe abortions going up. How severe are the injuries that women suffer after these abortions?
Depends. Some women are so bad that we have to remove the uterus.
Wow.
To remove part of the intestines. But the commonest one is infection. And then bleeding. And sometimes bleeding, we don't have enough blood products. So we lose some of them.
As a result of this policy, Mary Stopes International, which is a huge NGO that works across Africa and particularly in Uganda, they say that because of this policy, there will be an additional 120,000 backstreet abortions. Because of the gender norms in countries like Uganda, women don't have access to the same work opportunities that men do, same educational opportunities that men do. So often, uneducated women are forced to go into sex work when their husbands have taken off or have passed away. And as a woman being there, meeting people who are my age, who have a few kids and who are HIV positive, and talk about how President Bush saved their life with PEPFAR, and with that funding, he curbed the AIDS epidemic. And it's the reason they've been surviving with the virus for more than 10 years. Now with this new policy, that is all being reversed.
How long have you survived with HIV?
Kati kiyise emyaka nga 12 nfuna obujjanjabi ng'era ndi ku ddagala nga ndi ku ARVs nakatandika kati okuba nga bamisingamu okutuwa obujjanjabi.
Do you know why you're losing access to treatment?
Ensonga gye baatuwa olwasembayo mu Gw'omusanvu nga batugamba kimu nti Trump ya cruisinga okuleeta obujjanjabi naddala nga mu Uganda mu malwaliro agasinga. Sisobola kubaawo nga tewali ddagala lwa nsonga emu nti kati obulamu bwange buyimiridde ku ddagala. Bwe mba sifunye eddagala n'abaana baba tebagenda kufuna kyakulya, baba tebagenda kusoma. Kindeetera okukaaba kubanga kati nze abalabirira ekyo n'otulika n'okaaba.
What do you do for work? How do you make money?
Ndi sex worker.
Here's a mother with, 4 kids with HIV who knows that she cannot survive if she does not receive this treatment. That's terrifying when your husband, who was the breadwinner, has already died from HIV. You have HIV now. You're performing sex work in order to support your children. And that was something that was hard to hear, knowing that part of the reason that could happen is because of our government. We only saw the effects of this policy 8 months in. After talking to doctors and women in Uganda, it's very clear that this is only getting worse in all areas of healthcare. People will lose their lives as a result of this policy.